This episode is called The Essentials because our Bringing Science to Life segment will focus on what the American Heart Association is calling the Essential Eight. If you know, it was previously known as Life Simple Sevens, those key 7 behaviors and factors which should be measured for improving and maintaining cardiovascular health. It includes getting active, eating better, losing weight, quitting smoking, controlling cholesterol, managing blood pressure, and reducing blood sugar. This was the framework the American Heart Association followed for more than a decade. But now we've added sleep as an essential behavior for optimal cardiovascular health. And here to talk to us about sleep is Dr. Nour Makarem. She's a cardiovascular epidemiologist and assistant professor at Columbia University in New York City. Welcome, Dr. Makarem.
Hi, Diego.
I'm going to be honest with you. I asked you to join us because, one, you're an authority in this field, and two, because I remember, I think it was 2018, maybe early 2019, when you shared with me that your research had indicated that sleep should be added to our list based on the effect that sleep had on our blood pressure alone. Well, here we are in 2022. The Life Simple Sevens became the Essential Eight. We've added sleep. How does it feel to know you were right?
Well, honestly, it feels really good that sleep finally has become, equal to the other health behaviors that we emphasize, like diet and physical activity. And I'm really happy because now in clinical and public health settings, we'll no longer just ask about diet and physical activity and smoking. We'll also be asking about sleep, which is such an important determinant of not just heart health, but even many aspects of our health, from our mental health, our well-being, and our risk for other diseases beyond just heart disease.
Well, I'm glad you're not gloating. I'm glad that you're really using this as an opportunity to teach and advance the work that you're doing. I remember when we first met, I was so impressed with, your research and just like the volunteer work that you were doing for AHA and our Go Red for Women movement. But why don't you tell us about yourself, who you are, who's Nour, and why and how you became interested in researching sleep?
Yeah. Oh, man. Now I have to think back like 10 years for when I first started doing research over 10 years ago. I actually have always been interested in health behaviors and the impact of health behaviors on chronic disease. And, one of the reasons that I'm interested in health behaviors is because, there are so many things around us that maybe sometimes are out of our control that impact our risk for chronic diseases like heart disease, but also our ability to be healthy and live many years of our life healthy, free of any disease. And health behaviors are modifiable. I think that's the reason that I'm so interested in health behaviors, is that it's something that we can take control of. It's something that we can change to empower ourselves and to live healthy lives. And I kind of came to the sleep world from studying other health behaviors, specifically diet. I was very focused on the effects of diet on chronic disease. And then, I started to, living in New York City, I started to notice that it's not just, my diet that even affects my health. It's also other aspects of the 24-hour cycle. And when we think about this 24-hour cycle, sure, we eat during the day, we work out during the day, and we hear a lot about our diet and our physical activity, right? But we didn't hear very much about our sleep, even though we spend about a third of our lives really sleeping. We spend a significant amount of the 24-hour day sleeping. And so I started to think about, what are the effects of sleep on health? Initially, I thought, what are the effects of sleep on health in New York City, where so many New Yorkers, I think, are exposed maybe to an environment that doesn't always support healthy sleep, right? With our hectic work schedules, with the level of noise, light, all these things in the environment that are known to impact our sleep. And I also started to think about sleep in relation to what I already was studying, which was diet, and kind of this complex interplay between our sleep and our diet. And so then, I started to focus my research program on sleep, but also, meal timing patterns and this delicate interplay between our sleep and diet pattern, and said how it affects, our risk of heart disease. And a lot of my research has focused on heart disease risk factors, specifically, blood pressure, but also, glycemic regulation and body adiposity, which we know are also leading risk factors for heart disease.
Well, now that sleep has been added to the essential eight, what do you hope will be the effect of adding this, on whether it's on the community health, on research? Like, what do you hope will be the effect?
I think that the immediate effect, I think, will be that this will kind of bring sleep into the conversation of living a healthy lifestyle. I think that in the past few years, there's been, we're hearing more and more about sleep, whether it's in the media or, even in the scientific community. But I think now, this kind of, for lack of a better word, legitimizes how important sleep is, that it finally made it to those essential, to the Life Simple 7 now being the essential 8. And now, one of the great things about the Life Simple 7 tool and now the Essential 8 tool is that it allows people kind of to screen themselves in a way to assess their own risk of heart disease. It's a quick tool in a clinical or public health setting also to assess someone's risk of developing heart disease, as well as many other outcomes, because we know that Life Simple 7 was linked to so many outcomes, not just heart disease, so it was linked to, cognitive outcomes, other outcomes related to health and well-being. So now, this brings sleep into the conversation. Now, now, and also now people's sleep problems are more likely to be addressed, right? Because now that sleep is an important thing we screen for, this means that now poor sleep is something that we detect and we're able to address to improve people's heart health. So I'm really excited about this new edition of sleep. I will say that, for the past 2 years, there's been a lot of mounting evidence about the importance of sleep for, body weight regulation, for having healthy blood pressure, for having good glycemic control, and for many other things, many other mechanisms that link sleep to heart disease. But and finally now sleep duration has been added to the Life Simple 7, right? So now this new sleep health metric, it's mostly focused on sleep duration, making sure that people get 7 or more, but less than 9 hours of 9 hours of sleep per night. And that's considered like the ideal sleep duration for heart health. But I think, and that's a really great step and it's a great improvement. And I do think that it makes sense to add sleep duration because it's the most widely studied aspect of sleep health. Our research shows that, if you, that poor sleep behaviors tend to cluster. So someone with inadequate sleep duration may also have other sleep problems. And so by screening for sleep duration, you may capture poor sleep health overall. However, I think it's important to also remember that, this is a first step kind of in the right direction. So it's important to remember that sleep is multidimensional. There are many aspects of our sleep that are linked to heart disease. So this new metric focuses on sleep duration. And I think, it's a fabulous new addition. But it's important to remember that our sleep quality also affects our risk for heart disease. The stability of our sleep patterns from day to day. Do we have a stable sleep schedule day to day? That also has been shown to affect our heart health. So there are many aspects of sleep. And of course, there's sleep disorders, which we know are like sleep apnea and insomnia, which also are related to heart disease risk. So I think that this addition of sleep duration is a fantastic new step in the right direction. But I think also it's important to remember that our sleep is multidimensional and there are many aspects of our sleep that we can improve to have better heart health.
We talk a lot about behavior and studying behaviors and looking at patterns. We know that over the last 2.5 years, so many of our patterns and behaviors have changed as a result of the pandemic. How do you think the pandemic has impacted sleep and our relationship to sleep?
I think that, so it's interesting, in parallel to the publication of these new Essential 8 guidelines, the American Heart Association published, where Americans stand kind of in terms of those Essential 8 guidelines. And this has been based off of pre-pandemic data. I think we're waiting to kind of analyze the post-pandemic data when it's available to see as a population where we stand in terms of our health factors and our health behaviors. But there have been a lot of studies that were done the past few years in different populations, trying to assess how the pandemic has affected our health factors and our health behaviors. And when it comes to sleep, honestly, the evidence has been mixed. some studies have shown that, and it's also mixed depending on, I think, where we were in the pandemic. I think that, initially, maybe people were able to sleep more because now you don't have to commute to work anymore. People also are able to now have what we call, having a stable sleep schedule between weekdays and weekends. We call that social jet lag, when there's a difference between how you sleep on weekdays and how you sleep on weekends. And that, this social jet lag is related to risk for heart disease. So I think we saw less of that because people were finally able to, they're finally able to sleep in. They're maybe more able to have a stable sleep schedule. But then, these past 2 years have also been stressful for a lot of people. And a lot of people have reported poor sleep quality, more difficulty falling asleep, more nighttime awakenings. So the impact on sleep really is going to be interesting to study when we have, that post-pandemic data.
I really look forward to.
I should say peri-pandemic data, because we're still in it. I shouldn't say post-pandemic because we're still, we're still in it. But I mean the 2020, 2021 data, where we were in the kind of the heart of the pandemic. Yeah.
No, I agree. I definitely know what you mean. And, I am so grateful that you and with all of your research are going to be able to help us bring those numbers to life and that data to life so we can better understand where we are and kind of like do a temperature check of where we are, or where we are as a society when it comes to sleep. I wanted to ask you something else, because like I mentioned, when we first met, it was through some of the work that we were doing with Go Red for Women. You've been a supporter of Go Red for Women for many years, and you've benefited from Go Red research grants. So let me ask, how important is it to support research and to encourage young women to pursue careers in STEM fields?
I think, so important. And I'll say, maybe I'll talk a little bit about my experience first. I became involved with the American Heart Association through my postdoctoral training. I'll start by saying that I'm an immigrant to the US. And, after finishing my PhD, I was eligible for very few postdoctoral trainings. And the American Heart Association invested in me and in my research. And honestly, without that investment, I wouldn't be here today. The American Heart Association postdocs was actually one of the few opportunities that was available to me as a woman and as an immigrant. And because of that investment, I was able to kind of launch this research career that I have right now. I'll also say that the first grant that I got, the first independent research grant that I got, was also from the American Heart Association. And that grant also helped me launch my research career. After getting that initial grant from AHA, I then went on to get research funding from the NIH, from both NHLBI and NIMHD. And in fact, both of those grants are focused on sleep and blood pressure, and one of them is a clinical trial to see if just standard Life Simple 7 education versus Life Simple 7 plus sleep, which is now what we call the Essential 8, actually improves cardiovascular outcomes. So it's a clinical trial that's going to provide, great evidence for causality. And to be honest, none of that would have been possible if I didn't have that initial investment in my research program from the American Heart Association. So I'm very passionate about working with AHA. I'm very passionate about working with AHA specifically to encourage women to pursue research, because I know that my own research career would not have been possible without that initial investment from the American Heart Association. I also want to say that, beyond encouraging women to not just get into STEM, but remain in STEM, because it's not just about getting people to do research, it's about helping them sustain those research careers. I think that AHA does fabulous work with lowering risk for heart disease among women. As you know, for a long time, Diego, heart disease was considered a man's disease. And I think that AHA's awareness in that space helped to change that mindset so much. And now we know so much more about heart disease in women because of the work, the research and the advocacy work from the American Heart Association. And I will say, we were talking just earlier now about, I'm a new mom, and AHA, for example, now is investing in kind of looking at maternal health, which is a huge issue in the United States. And having just recently gone through this experience myself, I recognize how much cardiovascular health in pregnancy, but even in that postpartum period, how much of a stressor that is to a woman's body. And I think that AHA, by investing in maternal health, is going to help so many women. And by investing in women to do this research, that will be so impactful, because honestly, lived experience is also experience, right? So I think investing in women to do this type of research too, and improve outcomes for heart health of women is so important.
Well, Dr. Makarem, it is my pleasure to welcome you. I mean, you are a phenomenal researcher and passionate supporter of the American Heart Association. I'm just so thrilled that you are our first guest on this podcast. I want to keep reminding our listeners that this podcast is really going to be about celebrating health, and doing that by uplifting our guiding values. You truly live by the guiding values of the American Heart Association, from bringing science to life to making an extraordinary impact, inspiring passionate commitment of the young women who you inspire, and ensuring equitable health for all people, and for women across the country and across the world. So it has been my pleasure. I'm delighted to be able to share those last 15-20 minutes chatting with you. I'll say it, you were right. And you continue to inspire all of us with your research and your ability to share and bring that research to life. So thank you once again.
Thanks so much, Diego. And thank you to the American Heart Association for always investing in scientists and bringing, the most important research to the forefront. And also, we have to acknowledge, obviously, the committee who, published the new Essential 8 guidelines for, adding sleep. And I will say, it's been a long time coming, and I'm glad to finally see it in the guidelines. And I hope that now that it's in the guidelines, we can help people achieve healthy sleep for better heart health.